going to start here and basically we're going to lay off a whole bunch of RNs. You know, I mean, that wasn't what was said, but we're going to do our workforce redesign. Which, well, what does that mean when they talk about tasks and that? So our concern again is that that a lot of nurses around the province will lose their job. And again, the 4,000 brand new young men and women will not get jobs and, you know, after they finish their nursing education. What's been announced about this health workforce redesign, that many RNs could be replaced by licensed practical nurses, and many licensed practical nurse positions could be replaced by unregulated, the cheapest possible worker. Now that is being touted as a way of having a very flexible and inexpensive workforce. The real issue, though, is with licensed people, licensed RNs, licensed LPNs, you have some assurance that they know what they're doing, that they're accountable for what they're doing. So my concern again is that de-skilling the healthcare system could mean that if you indeed are one of the few lucky people in a hospital bed that hasn't been closed, that and again now, because 50% of all the beds are closed, you are very ill when you are admitted to hospital. You have very short stays in hospital, even in day surgery departments, emergency departments. You really want to have the most skilled, knowledgeable health workforce. What you've got is a healthcare system now that increasingly is relying on people who have absolutely no background to be assessing your needs, meeting your healthcare needs. So it's a great experiment that we're going into that really has not been tried elsewhere, and the research is very clear that hospitals that have a higher RN staff have better outcomes. That means less patients die. That means there's less mistakes. That means that people don't get readmitted back to hospital. That means people go home healthier because they've been educated on how to look after themselves. There's many positive outcomes when you have a higher RN staff, and it looks like we're moving in the opposite direction of that to save money, and for whatever reason, other reasons that there are. If you've got a McJob, you're just happy to be working. When you're an RN or an LPN, you actually have some pride and some knowledge, and you actually argue against poor planning, and you have a stake in the healthcare system, and you belong to an association, you belong to a union, and you have some voice then. And if we move to a healthcare system that's primarily run by these, you know, people that don't have any kind of a license or education behind them, it's a lot easier to herd the workforce. It's a lot easier to do whatever you want to the healthcare system, because you don't have as many educated people saying that isn't a good idea. I mean, RNs go into nursing because they want to help people. Doctors go into medicine because they want to help people. And certainly, I mean, you want to be paid reasonably, you want to be paid well, I mean, whatever. But again, I mean, you know, nurses are not upset because the contract is coming up. Nurses are upset because they think that every one of them could be laid off sometime in the next year or 2 or 3. But again, I guess my concern is just have much more of a pliant healthcare system when there's less RNs who say, I have a code of ethics. I have a professional reason for being here today. I have a professional career here, and I want to help the people of Alberta. So that's my concern with de-skilling the healthcare system, is that, again, we have a lot less qualified staff to not only provide good quality healthcare, but also to make sure that the planning in the healthcare system is effective, and looking at the future and planning and adapting all these new changes with new technologies and new drugs and new knowledge that come along.